The Kgalema Motlanthe Foundation Drakensberg Growth Forum, which has highlighted the importance of strong democratic leadership and partnership, as well as intertrade amid global policy uncertainty. I'm told now that the Minister for Health, Dr Aaron Motsoaledi, on the podium. Let's take you there.
It reaffirmed health as a fundamental human right, as it was declared when the World Health Organization was founded. Health is a fundamental human right. The second thing, it agreed on an international definition of health, because many people will define health differently. That health is not just the absence of disease or infirmity, but the state of good physical, mental, and social well-being. That's number one. But most worrisome is the Article 2 there. It says the existing gross inequalities in the healthcare status of people, particularly between developed and developing nations, but also within the boundaries of countries themselves, is politically, socially, and economically unacceptable, and is a common concern to all. Alma Ata Declaration ended with a slogan, "Health for all by the year 2000, and all means all." That slogan dismally failed. And the question is why? And the answer is number 4, the way health systems are financed around the world. Now, what is the problem? The problem is what we call financialization of healthcare. There's a growing influence of financial markets, investors, and corporate interest in the healthcare sector. Some of you might get angry and say we are discouraging investment, as we have already been told. But this phenomena is transferring healthcare from a public good, which it is, into a social service, into a commodified, profit-driven industry, prioritizing financial returns over people's health and well-being. Many people find the difference between healthcare and the economy. And I'm here to tell you, there are two sides of the same coin. Just try to run an economy with sick people and see what will happen. President Motlanthe, I told people, you were the president of SANAC in 2010 when we launched the world's biggest HIV counseling and testing in this country. If we never did so, many industries will have collapsed. In the mining sector, there will have been nobody. Many industries in South Africa will have collapsed if we allow healthcare to go in that direction. So to differentiate between the economy and healthcare is very dangerous. The financialization of healthcare completely disregards and undermines health outcomes, which are even defined in the United Nations development goals, the sustainable development goals as you know them, like life expectancy, maternal mortality rate, infant and child mortality rate, a fight against pandemics like COVID-19. They don't exist in the field of financialization of healthcare. What exists is how much money am I going to get? It also completely disregards an age-old concept of prevention of diseases and promotion of health, especially in this era where non-communicable diseases like high blood pressure, diabetes mellitus, cancer are now ravaging the world. In the next decade or so, we'll have forgotten about pandemics caused by biological organisms. And the biggest pandemic will be diabetes, high blood pressure, strokes, etc. And those, the mainstay of treatment of those is prevention of disease and promotion of health. And yet financialization disregards those. And it unashamedly promotes curative health care as the mainstay of the healthcare system, not preventative health care. If you check here in South Africa, for instance, we have got BioVac, a pharmaceutical company that produces vaccines. It is owned 57% by the private sector and 43% by the state. but the vaccines are bought by the state. 98% of the vaccines there to prevent this are bought by the state. The private sector, because of the problem of financialization, only pays 2%. That is the problem we are faced with. Now, what are the key features of financialization of health? Increased private investment in healthcare, but it's not investment for the sake of health. It's not for the benefit of health. Profit-driven decision-making. I mean, I can give you an example we have been complaining about. In the South Africa of today, if any pregnant woman ends in a private hospital, she will never deliver her baby normally. Women are no longer capable of delivering babies vaginally. They all get a Caesar, all of them. In fact, it's up to 80%, if I may be accurate. That is a profit-driven decision-making. Commodification of health. Healthcare is treated as a marketable product rather than a fundamental human right and a public good. That's what is happening to us. Now, what are the perils of this financialization? Inequalities in access to healthcare, reduced quality of healthcare. All the things I've put there are the results. Now, what are the global responses? Remember, I'm not talking here of one country. I'm giving examples of South Africa because I know it better. But this is a global phenomenon. Now, what are the responses? Healthcare financing trends are being studied by the OECD very thoroughly now. They are doing research. Health system financing is being studied by the World Health Organization. Both the OECD, Oxfam, United Nations University, and the World Health Organization have researched the growing involvement of financial institutions in healthcare, particularly in hospitals and outpatient services. And the overall solution, according to the World Health Organization, is universal health coverage, which we call NHI in South Africa, which is in court. There are now 8 fundamental cases against NHI, against universalizing healthcare in South Africa. There are 8 cases in court. When you count the sub-cases emerging from that, there are 19. And almost everybody who are in court defending the fact that healthcare must be universal and not commodified. Now, what are the contemporary events? Ladies and gentlemen, as I'm saying, this is a serious global phenomenon. Under the G20 presidency of South Africa, we put this as #1 priority. There are 4 other priorities. Let's not mention them because of time. But the first priority is the issue of universal health coverage, with primary health care as its anchor, as discussed in 1978 at the conference of Alma-Ata. Now we'll be having a health ministers, a G20 health ministers meeting in Limpopo on the 6th to the 7th of November. We've lined up lots and lots of powerful speakers to deal with this concept, to save the world. The WHO is going to be represented by its Director General, Dr. Tedros Ghebreyesus. We've invited Joseph Stiglitz, the Nobel laureate for economics, and all those prominent speakers there to unpack the concept of financialization of health. Now, what is painful, ladies and gentlemen, is that in South Africa, even the poorest of the poor, very poor people, are clamoring for private health care to the extent of selling their assets, a concept which WHO calls catastrophic healthcare expenditure. WHO has even got figures of people who were not classified as poor under the United Nations poverty data line, but because somebody got sick at home, suddenly the family is classified as poor. They fall below the poverty data line because they have to sell the small assets they've got because somebody is sick. So sick is this phenomenon that in South Africa of today, to gauge whether you have arrived or if you are a businessman, whether you have collapsed, they gauge by whether you go to a public hospital or a private hospital. Stories go around in the village. Hey, have you seen him? He's down now. I found him in a public hospital. He's in trouble. That's a very sick phenomenon. What is happening? As I've said, I've got new eyes. Yes, I've just done an eye operation. I chose to do it at St. John's Eye Hospital, a public hospital. And they did a good job. There was a feature article in one of the papers where they were praising me for bravery, for supporting public health care, for doing all the things with the poor, for wearing the hospital pajamas the patients were wearing. I was supposed to gloat under that, but something killed me inside, because it's written there, the minister is so, he has so decided to promote public health care that is prepared to risk his own eyesight. That's what was written. I'm risking my own eyesight by going to public health care. And yet the lady who did the operation on me is the one who's teaching people who are now in private health care. Because it's an ophthalmologist lecturer at VET. All the people who they are saying are good went through her hands. And when she operates me because it's in public health care, I'm risking my eyesight. That's the danger. You can imagine. The person who wrote that was not silly. It's what they believe. It's what they believe. Regardless of the fact that there are many good things that are happening there. Now, that is the danger that is befalling our country. And it's all over the world in many countries. Those are the countries that are implementing reforms to cap financialization of health. The UK in 1948, National Health Service, Canada, Medicare, Thailand, Indonesia, Brazil. We have all invited them to go to Polokwane and share with us their experiences. Now, Motlanthe, if you go to Steve Figo Academic Hospital, we have got one of the best nuclear medicine facilities in the whole continent. And I dare say in many parts of the world they don't have it. 40% of the patients there are referred by the private sector. 50 patients since 2017 were referred from Europe directly. Tell that to a journalist in South Africa, they will believe you must go to Vescopis. You have lost it. In a public hospital, you have lost it. When we appointed the Director General of World Health Organization on the African region, Professor Janabi, he actually mentioned this in the acceptance speech, that in Kenya, they have got a renal unit where they do renal transplants. In Tanzania, he himself, as a cardiologist, has established a cardiology unit, which is world class. But when you talk of Africa, it's only the negatives. And the painful thing is that even leaders in Africa believe it. When they are sick, just check all the heads of states who go to die in Europe, Asia. They don't even believe in healthcare systems in their own countries because of this phenomenon of financialization. And it's an issue that we must face head on. Thank you very much.